All right, sometimes we'll have patients come in that are doing a running eval, which is where they work with Casey to go over gait and make sure they're running correctly. And so it's important that we make sure the treadmill is on well before the patient gets there, just so that they're not waiting for it to warm up or anything. And then when the patient gets there, Casey usually likes them to do a warm up on the upright bike for about 5 minutes, and then they can go over to the treadmill and start doing a warm-up run for about another 5 minutes, and then Casey will work with them. This exercise is called ball circles. So you'll have the patient stand on the affected leg, and they're just gonna move the ball around in circles, going all the way around. And they'll do 10 times clockwise, and then they'll also go 10 times counterclockwise. All right, this exercise is called T-band pronation supination. And so they'll have the band to offer resistance. The first way, the aide will be holding it kind of at an angle this way, and the patient will bring their foot up and over to the side in one motion, like this. And then the other direction, the band will be held kind of at an angle this way, and they'll be bringing it down and scooping in. 3 sets of 15 both directions. One of the aides should be helping them with it, just so they can have their leg outstretched on the table and do the 4 different directions. All right, this exercise is called eccentric T-band 4-way. So it's like the T-band 4-way that you learned in the entry level. The only difference is they'll move their ankle in that direction. So this is E version. You'll pull it tight, and then they'll slowly release. And then you'll do that in all 4 directions, where they pull it tight, the tension, and then slowly release.
So this is kind of an evaluation, but also you can be used as an exercise or a test. So what you're doing is you're having a patient start at a certain spot. So you mark that right here where the front of their toe is. And then the objective is for them to jump as far as they can while only using that leg. So if it were a single leg hop, I won't jump as far as I can just to show you, but I would hop as far as I can, land, and hop again, and land, and you would measure from where they reach their toe. So you get out a measuring stick and do that. A burpee is you probably know it, but you're coming down, kicking your legs out, kicking your legs back in, coming up, jump, down, back, back forward, jump. Squat jumps. You're in the squatted position here, and you're going straight into a jump and right back into a squat. You want to be careful to have them not land too far forward on their knees, so make sure they're really sitting back like they're sitting into a chair. So cone jumps can be side to side, forward, back, again 2 feet or 1 feet, and you can either go for height or for speed. So if you're going for height, you're just doing as high of a jump as you can, landing, and then coming to the other side. Sometimes the therapist may indicate for them to do like a small hop, so you can do like a quick hop and then over. Same thing front to back, over and back, and then with one leg. Okay, so when you have a square drill, you can either have tape on the floor, or I just put some straps down to use. And you can do these either 2 feet or 1 foot, single leg or double leg, and there's just different directions you do. So for example, if we're doing double leg, we can do front to back, over the line, like that. You can do side to side, over the line. You can do a diagonal or a square pattern. And then all of these can be done with 1 foot as well. So really you can do any pattern that's indicated on the chart. This is similar to the square drill, but there is a 5-dot pattern. So this can be tape on the floor or something like that. I'll demonstrate it without it, but basically you think there's 1 dot in the middle, 4 dots around it, and you can do different motions, 2 feet or 1 foot. So for example, if you're doing like a hopscotch pattern, then you're starting behind with your feet open and you're going to the middle and up, following that square pattern or that 5-dot pattern. Okay, and then you can do like a V or a Y. So you're here, back, doing a Y pattern. So really any position, X, anything you can do with the dots.
Okay.
Okay, and then a skip jump is what it sounds like. It's a skipping motion, but they're going forward. So they're coming here and they're jumping and landing. Okay, this one is split jumps or jump lunges. And basically the position is you're in a running or a lunge position and you're jumping and switching.